I have so many, to be honest, ranging from the really heartbreaking ones to moments that we can actually come together and unify about. I think for a long time, we've had a very broken healthcare system in this country, and this pandemic came in like a flashlight and just lit up all the fissures in our society, everything from healthcare access to problems in our supply chain to abuse and burnout in healthcare to racism, systemic racism in our healthcare system. And now it's on full display, and I'm hoping that we can use that to make some change. But I also want to make sure that people are reflecting on the incredible feats of humanity, philanthropy, the scientific achievements, and the realization that we really are one humanity. And when we all work together or when we work apart from one another, there's huge consequences or benefits.
So many important things to keep in mind. A year ago, many of us were preparing for lockdowns. I know I've been talking to my friends and neighbors as our world was changing before us, thinking that we would be back to normal by summertime. So here we are again. What is your outlook as we see things starting to open up in certain states across the country, but also other parts of the world?
I have an optimistic outlook right now, and to be honest, a lot of that is because unfortunately people have learned the hard way of what happens when we don't follow restrictions, but also the vaccines are really proving to be worth all the hype, and the real world data is proving what we saw in clinical trials, and that is great news. And I think we're able to get out of this now, and hopefully we'll emerge stronger, and we'll actually take lessons from what went wrong during this pandemic with regards to pre-pandemic preparedness, because this inevitably will happen in the future. But, as optimistic as I am, I'm very scared about what could potentially go wrong if we don't address these issues, if we don't pay attention to the inequity in everything from healthcare access to patients being able to go to the hospital. In the beginning of the pandemic, a lot of people would go on TV and say, if you have symptoms, talk to your doctor. Well, we have over 30 million Americans who don't have health insurance and may not even have a physician. And so I'm hoping that as we move forward, we really just nail down all these issues, just make sure that we're better set for any other surge that could happen in the future.
Let's focus on the kids. I know you're a pediatrician. A lot is being made, especially right now with the vaccines coming into play, about children and education and what they've lost over the past year. Should kids go back to school full time at some point this school year? Do we wait until the fall? And have these kids lost too much given what we know right now?
Well, this is a loaded question, but I'll do it step by step. So I do think that unfortunately kids have lost a lot from being out of the school system. We've had over 1 billion kids worldwide be away from in-person classrooms. Now, some kids, I'm going to be honest, have actually done really well if they have the right learning condition and they have the right resources, unfortunately. But other kids who have been in at-risk homes, food insecurity, they're not in an optimal learning environment, have fallen behind. And I've heard this from a lot of parents and from a lot of teachers as well. So I think moving forward, we know the science is clear, and that with the right safety measures, schools can safely reopen even during the vaccine process, because we won't have kids vaccinated fully until probably next year, especially younger children. Teens probably sooner, this fall. But I think it's really important for people to now give thanks to the education system. Maybe we should treat our teachers better, because we know how crucial it is to get kids back into classrooms. And I just have to say, I've heard from so many parents who are just at their wits' end in trying to maintain a job, a sanity in their household, and teach their kids. So I think the priorities are on and just getting schools back in session as quickly and safely as we can.
Yeah, I hope teachers everywhere get a raise. We know that U.S. President Biden recently made a huge purchase of vaccines, Johnson & Johnson. Do you think every American will be vaccinated by May as they're hoping? And then what happens to all the people who decide they don't want to get a vaccine? What happens to them?
Well, I'm glad that you're bringing up the differentiation of the vaccine supply versus Americans getting vaccinated. So you're correct. President Biden has said, and we have the evidence, that there will be enough vaccine supply for all Americans by May. But the issue now becomes is actually, are we going to be able to get them into people's arms? Now, vaccine hesitancy is one huge issue. People have to actually want to go and get the vaccine. There's data that proves that they should. We have reason to believe that they are very safe and effective. We hope everyone does. But also, we got to make sure we think about the supply chain, which has failed us time and time again throughout the pandemic. We need to make sure there's equitable distribution of the vaccines. There's mobile clinics when they're needed, that only people who are able to use social media or drive 2 hours and go wait in line are not the only ones getting these shots. And they're going to resource poor and rural communities as well. I think if we have all that working in the same way, there's cultural competency, we're rebuilding trust, we can get everyone vaccinated. I think inevitably there will be a small percentage who doesn't go and get the shots, but I'm hoping enough people will so we can get to that 75, 80%, get to herd immunity and get out of this mess.
And a couple of seconds left. If that happens, will COVID go away?
I don't think COVID will completely go away. It may subside for the near-term future. We're just hoping it doesn't mutate and cause more surges and create more issues in our healthcare system.